Show you what's possible for these black triangles on lower teeth. So first of all, black triangles are these spaces that happen in between teeth. It happens for a variety of reasons. I have other videos on black triangles and even a in-depth YouTube video. Now there is a procedure that we can do to fill in the black triangle to reduce the appearance of the void. And the cool thing is that it's super conservative because you're just adding composite. But the issue is the lower is trickier than the upper to do because it's an area that generally accumulates more tartar buildup. So I will only take very specific cases when it comes to black triangles on the lower. This patient, for example, is very diligent with her hygiene, sees her hygienist every 3 months, and she accepts that these may not last as long. First, I had her get a cleaning from her hygienist, so everything is nice and clean. This purple thing is called a rubber dam. It just helps to keep the teeth isolated, so there's no mixture with saliva and blood while we're filling this area. There are 2 little matrices here, and you can see that this area is right where we're going to fill on this tooth, and this area right where we're going to fill on the other tooth. Part of the issue here, not the complete issue, but part of it is that this tooth is very triangular shaped, so it's really skinny at the neck, and then it flares outward. And so there's not a lot of tooth structure at the base to kind of push the gums together. Here's what it looks like when those areas are filled in with composite. So we did this triangle here, this triangle here, and this triangle, and each triangle consists of 2 separate fillings, one on each side. You'll notice that the gums are a little on the puffy side, and that is because when we put the matrix in, we want it to go right underneath and be seamless with the root structure. So this filling material, the junction of where it starts is slightly under the gum line, and this will heal. Now this is the part that surprises everyone. Doing a few of these takes me at least 3 hours. So it may look really easy, but for me, I take a lot of time making sure that the composite is seamless with the root. We don't want any ledges. We don't want any catching of the floss. The floss should just go in and can't even feel where the tooth stops and the filling starts. These areas also need to be highly polished because if you don't, the tartar is going to stick there even worse. And the reality is this is an area that hygienists usually have to concentrate a lot of time, especially for people who build up tartar really easily, and you don't want to make their lives worse or harder. If these types of procedures are not meticulously done, not only will it be a pain in the butt for your hygienist, but it will make your periodontal situation worse, which is exactly what we don't want when we're kind of doing it for aesthetics. Now, I do have patients where we've done these and they've been able to maintain them for a really long time. And the hygienists even say that it has helped because it has reduced the amount of tartar buildup because there isn't like that space for the tartar to build up in. The polish is so fine that it doesn't stick as much to that area.